Maybe you don't know much about oral and facial surgeons. Even other dental healthcare professionals can be unaware of all we can do. So we're making it easier to get to know us and the patients we've helped through oral surgery. Our new website has all kinds of great information. You can see what's involved in various oral and facial surgery procedures. Just click on one of our ads on your favorite websites, or when you look us up on Google. We're also talking to your family dentist so he or she can better advise you about your work.
I would say to that oral surgeon today, thank you. Thank you so much for helping me understand about my own personal health and self-care. Thank you.
Get to know us. We're here to help.
More and more people are looking at dental implants as the best option for replacing their missing teeth. Patients who have had dental implant surgical care by an oral and facial surgeon relate that the final result is like having their natural teeth. Receiving dental implant care involves oral facial surgery, and obviously surgery should be performed by a surgical specialist. In this case, an oral and facial surgeon who has the training and experience to provide you with the best possible surgical result. A dental implant is composed of 3 parts: a titanium implant that's put in by the oral and facial surgeon, which actually fuses with the jawbone. Second, the abutment, which fits over the portion of the implant that protrudes from the gum line. And finally, the crown, which is created by a restorative dentist. Oral and facial surgeons are the surgical specialists who are the experts in surgical implant placement. Why would you trust your dental implants to anyone else?
My name is Ying.
My name is Gordon.
My name is Michelle. I went through the typical phases of orthodontia. I had braces for a long time. I was told by my dentist that I had missing permanent teeth.
I went to my dentist and he saw that this tooth was kind of misplaced. It was sticking out a lot, like the tooth was gonna go. He sent me to an oral surgeon pretty much right away.
I could feel like this pain going all the way along the side of my mouth. I couldn't even eat on the side of my mouth. I went to the dentist and he told me that there had been decay and an infection in my jaw.
I would feel sort of held back by my smile and that people were judging me for the way that my teeth looked.
I would go to a receptionist or something and talk to her, and then you could kind of see them kind of do a double take, and then I was like, oh yeah, I better cover up my teeth.
Basically referred to me to a specialist, a maxillofacial specialist, and he said that your jaw is decayed and we have to rebuild the jaw.
I was told that this wasn't a job for an orthodontist, that I needed an oral surgeon.
I was a little bit frightened about it. Didn't know what was going to happen to me. So he sat me down, he showed me some pictures of the entire process and what's going to happen. Once the jaw was rebuilt, they would drill holes into the newly rebuilt jaw or the newly formed jaw, and where they could put the implants in.
It really educated me on what she was going to be doing, what was going to be happening to my mouth.
Every single visit, he was like, this is what we did, this is how far you come along.
I felt like the process was worth the result. He knew what I really wanted for my smile.
It's the same coloring, it's the same shape, same size. It totally looks real. To someone who's thinking about getting a dental implant, I would say totally go for it.
It elevated my confidence to a level that it had never been at.
I enjoy cooking. Now I enjoy the food on both sides of my mouth.
I find that I'm smiling much more. I never knew that my cheek muscles could hurt that way because I'm constantly smiling and showing off my teeth. The oral surgeon is trained to do this.
Wisdom teeth, or third molars, are the last teeth to develop and enter your mouth. If wisdom teeth come into the mouth in a proper position and meet certain conditions, it's generally accepted that you can keep them. However, they are still prone to disease, even if you experience no pain and have no symptoms. This is why the American Association of Oral and Maxillofacial Surgeons strongly recommends that third molars be evaluated annually from the time a patient is a young adult. Studies have shown that about 9 out of 10 people have at least one wisdom tooth that can't break through the gums in an upright, functional position. As we say, it becomes impacted. If left alone, an impacted tooth can become infected or damage neighboring teeth. That can lead to gum disease and even the formation of cysts or tumors. By the time you feel pain or notice that something is wrong, it may be too late to prevent the problem. The tooth does have to be removed. It's better to do it when you are young and the roots haven't fully formed. There's less chance that the roots of the teeth will damage nearby nerves or other structures. Oral and facial surgeons are the recognized specialists in the management of third molar teeth. Usually the surgical care can be provided in the oral and facial surgeon's office. The surgeon's skill and knowledge of anesthesia care assure you of a safe and comfortable surgical experience. If after consulting with your family dentist and oral and facial surgeon, you decide to keep your wisdom teeth, they do require proper management. That includes professional cleaning on a regular basis, annual checkups, and periodic x-rays to monitor for changes. This will ensure the best possible oral health as it relates to your wisdom teeth.
Hi, my name is Mark.
Hi, I'm Phyllis.
Hi, my name is Roger, and my story is I went to the dentist because I was having a lot of pain in my back teeth, and I had wisdom teeth impacted. It seemed to him that there was an unusual amount of bone loss.
Several years ago, I was having some pain with my wisdom teeth, and I went to the dentist to have them evaluate and see what was going on. Along with that examination, they determined that I had a tooth that had never descended and was actually fully grown and impacted in my nasal cavity.
I had a swelling on the side of my face, and I went to the dentist. And he immediately walked me down the hall to an oral surgeon. I had a huge cyst. It had wrapped itself around the nerves to my face, and it was larger than a golf ball.
He recommended that I see an oral surgeon, and he agreed that it was unusual for someone in their 30s to have this amount of bone loss. And he suggested strongly that I take an HIV test. And so I did, and it turns out I was HIV positive, and the result was showing up in bone loss in my mouth, severe bone loss.
After my general dentist referred me to this maxillofacial surgeon to talk about, possibly extracting this tooth, I had never even heard of a maxillofacial surgeon before this, so I was quite intimidated. He seemed pretty confident that he knew what he was talking about, and that put me at ease.
The oral surgeon had equipment that the dentist did not have. He told me what had caused the cyst, that it was caused from the impacted wisdom tooth. He told me the severity of the problem, so he recommended that we do surgery immediately, which we did within, I believe it was a few days.
There was a lot of sadness around losing my teeth and feeling HIV, knowing that I was HIV positive, and then to have such a wonderful experience with this oral surgeon, not only just the work that he did on my mouth, but the understanding that I could be healthy again, that he was encouraging me.
I hate to think what would have happened if I'd never gone to the oral surgeon that day. Basically, he saved my face.
I think the surgery went well. I have a smile that I'm proud of.
In my case, it was really about saving my life. I would say to that oral surgeon today, thank you. Thank you so much for helping me understand about my own personal health and self-care. Thank you.
Maybe you know that tobacco and drinking alcohol can increase your risk of developing oral or throat cancer. But the fastest growing cause of these cancers is the HPV virus, or the human papillomavirus. In fact, if you have HPV, you are 30 times more likely to get oral cancer, and it is affecting young people with increasing frequency. That's why everyone should perform an oral cancer self-exam each month. Stand in front of a mirror in a well-lit area. Feel the inside of your lips and cheeks, the roof of your mouth, the front and back of your gums, and all the surfaces of your tongue. Look for lumps, bumps, sores that don't heal, or discolored patches. Oral cancer can happen to anyone. Early detection is the key to a cure. If you find anything unusual, see your general dentist or an oral and facial surgeon as soon as possible.